So I'd like to now talk about some nutrition essentials. And we have been doing conferences for quite a while. And our conferences include researchers and clinicians from all around the world who are doing really breakthrough work. And that's why they're here, to share with you the findings that they've had so that we can apply them. However, we started to hear from a number of people who said, some of us are a little bit new to nutrition. Let's cover some of the basics first so that we're all sort of on the same page. So a little bit later this morning, Dr. Michael Greger will be with us to talk to us about how not to die. But before that, I would like to just go over some things that to me strike me as very, very important, that I just like to go over them. We'll talk about heart disease, we'll talk about obesity, diabetes, and a little bit about the process of change. So let's talk about the heart. We learned a long time ago that the higher your cholesterol level, the more likely you are to die a cardiac death. And all the evidence that we have is very, very clear on this point. And what makes cholesterol levels go up? Saturated fat, number one. And the numbers are different for every person, but typically a 1% rise in your saturated fat intake is going to add about 2% to your LDL cholesterol level. So as soon as you say this obviously important thing to your patient, the patient will turn to you and say, I just read in a magazine that coconut oil is okay. In fact, it's good. It's good for my heart. In fact, it even makes my car shine, and it's a good thing, and this is true. So if you don't mind, in today's talk, I want to walk you through some of these questions that are going to come up. So the first thing is, what is coconut oil? If you're in Cancun and you look at those trees, those are coconut palms, and that's where it comes from. The palm oil is from a different plant, although also heavily saturated. So the coconut falls to the ground, and that fleshy part of the coconut is where all the fat is, and it's not your imagination. It's a very waxy substance, which is a sign that it's about 92% saturated fat. If it were any worse, it would be Vaseline. And the question is, does it actually raise cholesterol or not? And what many people have said, and they're correct in saying this, is that there are different saturated fats. There's a 12-carbon chain and a 14-carbon chain and 16 and 18 and so forth. And they do have different effects on your cholesterol level. Some of them less innocuous than others. And so they have used this to suggest that coconut oil is different from butter, for example. So let's look at the numbers. There are a number of studies that have looked at this, but they all come out about like this. If you look at either total cholesterol or LDL, you might use for comparisons a liquid oil like safflower oil, which is relatively low in saturated fat. And as you can see, coconut oil raises your LDL, and it'll also raise total cholesterol. Now, butter is worse, but this does not mean that coconut oil is innocuous or healthy or in any way lowers LDL. We clear? So it's part of the problem, not part of the solution. Time magazine weighed in and said, okay, you should eat butter. Do you remember this cover? Mark Bittman from the New York Times also said butter is back and you should be eating fatty pork products and so forth. What they were referring to, and what has continued to confuse, unfortunately, sometimes our colleagues but also our patients, is this relationship between saturated fat and coronary disease. And both the Time article and Mark Bittman's piece and lots of the media really came from a meta-analysis that was published in the Annals of Internal Medicine in 2014. And if you're not familiar with meta-analyses, every line is a research study. And you hopefully put them all together and you look at the net result. And if you're on the right side of that vertical line, that means saturated fat is risky. If you're on the left side, saturated fat is safe. Now, very important, meta-analyses are designed to combine studies using the same methodology. So you give the same medication to a whole lot of people in different studies, you can combine the results. But if the methodologies are different, you can't really add it up. That doesn't stop people from publishing them, nonetheless. So in this particular study, the Oxford vegetarian study was included, and it had very nice methodology because it included people following vegan diets, vegetarian diets, some meat-based diets, a broad range of saturated fat intake that helped the role of saturated fat to be evident. They also included the Malmo study, and the authors from Malmo, Sweden, said, we don't have anybody in our population who follows a low saturated fat diet. And they explicitly said that their study should not be used to look at the relationship between saturated fat and coronary disease because they didn't have any range, dietary range. Nonetheless, this meta-analysis added all these different studies together, and instead of saying the truth, which is that you can't really make much of it, and you need to look at specific trials that have more value, they basically said there's no effect. And so, needless to say, people who love bacon and sausage and cheese were thrilled to know that it won't affect their heart anymore. The saturated fat is the big driver for plasma cholesterol levels, but dietary cholesterol also increases plasma cholesterol. And everybody's different, but typically 100 milligrams of cholesterol in food would add about 10 points to total cholesterol. And your patient will then turn to you and say, wait. I heard that cholesterol doesn't matter anymore. And I'm sure I read that from the government, that cholesterol that you eat doesn't have any effect. Okay, back up. Let's look at this. Here are the sources of cholesterol in the diet. Eggs are number 1. Chicken is number 2. Beef is number 3. And then there are many other sources of dietary cholesterol. And cholesterol from food passes into the bloodstream. Roughly half of it, between 40 and 60%, gets into the blood and adds to the cholesterol that's already there. And there have been many studies on this, often using eggs, sometimes using pure cholesterol itself, which you can get for research studies. And this was a Harvard study where they brought in 17 ovo-lacto-vegetarian students who were not eating meat, but they ate about 3 eggs per week on average. And in the study, they added 1 extra large egg to their daily diet. And in 3 weeks' time, their total cholesterol went up 12 points, their LDL went up about 7, their HDL went down a little bit, and triglycerides didn't really move. But this and many other studies have shown very clearly that dietary cholesterol affects blood cholesterol. And this was done by Bill Connor's group out on the West Coast, a crossover study. I feed half of my patients eggs for 4 weeks. The other half get egg substitute for 4 weeks. And you can see the cholesterol levels changing very rapidly. At 4 weeks, you cross them over. So the egg eaters now become the egg substitute eaters, and what you see is their cholesterol's come back down. And it's very compelling evidence that when you add cholesterol to your diet, your blood cholesterol will go up. The Institute of Medicine weighed in and said, all right, it looks pretty linear that the more cholesterol you eat, the higher your total cholesterol, or LDL, is going to be. However, this is the real key thing, is it really depends on what your baseline diet is. And this has been the source of no end of confusion, so let me walk you through this. If I'm a person who eats no cholesterol at all, I don't eat eggs or meat or dairy products, then if you add a daily egg or 2 to my diet, I am now that black line up at the top. Your cholesterol rises rather quickly. But if I start my day with a 3-egg omelet every day, and I'm eating bacon and sausage, and for dinner I have fried chicken, I'm getting a lot of dietary cholesterol every day, and if you add an egg to my diet, you don't see much effect. I'm one of those lower down curves. Are you with me? Okay, so it's like if I am a non-smoker and I had 3 or 4 cigarettes a day, will that hurt me? Will it? Yes, no question. If I'm a 3-pack-a-day smoker and I add 3 cigarettes, will that show a detectable? Not necessarily. So, the world became very confused following the publication of a study by Griffin and Lichtenstein at Tufts University. They reviewed 12 studies, but they took no studies prior to 2003. And their conclusion was that the effect on plasma lipid concentrations is modest, and it appears to be limited to only certain population subgroups. Alice Lichtenstein was then appointed to the Dietary Guidelines Advisory Committee and was on the subcommittee that decided to say that cholesterol in the diet doesn't affect blood cholesterol. And so the world decided, great, We should be eating eggs again, stuff as many down our mouths as we possibly can. And while we're at it, there's other things that I think really should be exonerated. So I want to go into the weeds a little bit with the Griffin and Lichtenstein paper. Here were the 12 studies. Here are the funding groups for the studies. 10 of the 12 were the egg industry. And there's a couple of details, but I've put a U by every study where the effect of dietary cholesterol on blood cholesterol was unfavorable, meaning it went up. And I put an F by every study where it was favorable, whether it was statistically significant or not. But you could see a really clear trend that dietary cholesterol affects blood cholesterol. And so the bottom line is you can make the effect disappear if you are the egg industry and you fund a study in which you bring people in who are already eating a large amount of dietary cholesterol. You bring in a small group of people so that you don't have statistically significant results and you can declare null results. So we had quite a wrestling match with the Dietary Guidelines Advisory Committee a couple of years ago. And to their credit, the USDA and HHS came out basically on our side saying, okay, you really should eat as little cholesterol as possible. So end of story. Now, it really doesn't matter very much, though, because the same foods that have cholesterol also have a lot of saturated fat. So animal products, take a look at cheese, for example, at the bottom. It has cholesterol and saturated fat. Salmon, same story. It's got cholesterol as saturated fat. Compare that with plant products. Plant products have effectively no cholesterol and very, very little saturated fat. So it's something people debate, but anyway, bottom line, you've got the drivers of plasma cholesterol. We are seeing a huge trend now in a shift toward plant foods. A Mediterranean diet, which has been promoted by the Dietary Guidelines for Americans, really gets its fame because vegetables and fruits play a starring role, and instead of butter, there's more use of plant oils, which I'm not necessarily recommending, but it's a shift in the right direction. And the Dietary Guidelines also came out emphasizing the benefits of vegetarian and vegan diets. And the DASH study, we're familiar with the DASH study for blood pressure. When the study was launched, they said that their inspiration was because people following vegetarian diets had low blood pressure. But they felt it was hard to follow that kind of diet, so they modified it a little bit. But the theme for the past many years has been a shift away from my North Dakota diet of focusing on meat at the center of the plate and moving toward plants, which is a good thing. This is a study that's about to be published in Nutrients on plant-based diets and LDL cholesterol, and as you can see, the effect is quite consistent. Okay, taking this to another level, you're familiar with the work of Dr. Dean Ornish, who back in 1990 wanted to see if you could actually affect existing cardiac disease, and he used an experimental diet with people in the hospital for coronary disease. He started them on vegetarian foods, a half-hour walk every day. He asked them to manage stress, which is why he didn't do the study here in Washington, D.C., and he also asked them to avoid tobacco, and that was the whole program. And after a year, comparing this group to a group that followed their doctor's recommendations, which could have included medications, a chicken and fish type of diet, you could see that the experimental group, I mean, they did terrific. Their LDLs dropped 37%. The average person lost 22 pounds. Their angiographic results showed reversal of heart disease in 82% of patients. And so this is why now Medicare will say, doctor, do this program and I will pay you, because it's cheaper and better in many ways than many of the treatments that patients are otherwise subjected to. After 5 years, he looked at the risk of having another MI or needing angioplasty or bypass or cardiac death, and showed really dramatic improvements when people follow this. I didn't know Dean when he started this work, so I called him up and I said, Dr. Ornish, everybody's going to believe this works. Nobody will believe that a patient will actually do it. And so he invited me to come out to California and to interview all his patients, all the participants in the study, in both groups. And the people who were in the experimental group, they did say, it took me some getting used to. It was maybe 4, 5, 6 weeks before this diet really felt second nature to me. But I am never stopping this because my chest pain was gone within, and it was gone very impressively, very fast. I'm losing weight without counting calories. I've got more energy than I've had before. My numbers are the best they have ever been. And when I talked to the control group, they said, this is really challenging. It's just chicken and fish and chicken and fish and chicken and fish, and I'm not really getting better. My numbers aren't a whole lot better. I still need medication. So what we concluded was that all interventions do require effort, and a plant-based diet isn't harder than any others. And we've tested the acceptability in a number of groups, and we find that if you don't have to have a calorie limit or portion limits, or you don't have to count carb grams, and you get benefits, people often do want to stick with it. And we've published on this, and I really encourage people who are doing diet studies to ask their participants in structured interviews how they like it, and are they going to stick with it? Because you want it to not only work, but also to be something that a person can stick with. Okay, let's shift gears. Let's talk about healthy weight. I was inspired by the work with cardiac patients to see what happens to a person who isn't a cardiac patient, but they've got 40 pounds they want to lose, or 140. So we invited 64 postmenopausal women into our research center up on Wisconsin Avenue, and we gave them 2 rules. The first rule was no animal products in their diet and to minimize oils. There was no calorie limit and no exercise in the study, and it was a 14-week trial. And we asked them to eat from the power plate, meaning fruits and grains and vegetables and legumes. Legumes are beans, peas, lentils, okay, foods that grow in a pod. And it looks like a rather indulgent diet if you just came off Atkins, because we're allowing you to eat pancakes and oatmeal and linguine and all these kinds of things. But on the other hand, there's no animal products in it at all, and we also kept oils extremely low. But at 14 weeks, your average person had lost 13 pounds, 2 inches off their waist, and through glucose tolerance testing, we could show a clear-cut increase in insulin sensitivity, and we tracked them for an additional 24 months and showed that the weight loss just continued through that period of time, which is great because you're not calorie restricted. You don't have the hunger drive to make you break your diet. And so this is a meta-analysis of every study using plant-based diets and looking at body weight. And now the 0 line is on the far right. And so as you can see, every study is to the left of that 0 line, meaning every single study shows weight loss when people do this kind of diet. Okay, so very important. Your patient is going to say, I really think I'm overweight because of sugar. And you can reassure them that sugar is not health food, and soda is not health food, even if it's Dr. Pepper. So that said, if that is all they are focusing on, they are missing something important. And this is going to be on the test, people. A gram of sugar has 4 calories, a gram of fat has 9. Are you with me? Okay, your patients forget this instantly. So I want to make sure we got this. How many calories are in a gram of beef fat? Are we sure? Good, okay. Chicken fat? Fish oil? Even if it's wild-caught salmon? Okay. Olive oil? Extra virgin olive oil? Extra virgin olive oil? 1040 motor oil? If you cooked with it, it actually does have 9 calories in every gram. Okay, so when you go to a restaurant, they're happy to make you a vegan meal, but they're going to slather it with olive oil because restaurateurs are in love with their oil. So I'm going to raise a question. Once again, sodas are not health food. People should throw them away, and your patients should not be having them. However, sweetener consumption has been falling in the United States ever since 1999, when bottled waters edged enough sodas off the shelf that sugar and sodas has been falling. Cheese, on the other hand, has gone in the opposite direction, and so what? Is there any fat in cheese? The leanest beef, the leanest chicken, fish, and plant foods, you could see that this is the fat content as a percentage of calories. Where is cheese? Is it more like the beef? Is it more like the broccoli? Where is it? Okay, typical cheddar cheese, mozzarella cheese, 70% fat as a percentage of calories, mostly saturated fat. So we feed this to kids because it's got some protein in there somewhere in amongst all the fat. But keep in mind, very, very big contributor to weight problems, I would guess. Now, you can get a sweet taste from soda without any calories. There is Coke Zero. There is no Cheddar Zero. Okay? So it's always got calories. All right, so which is better for weight loss? Cutting the fat or cutting the carbs? You can lose a lot of weight on a low-carb diet, and people do, and weight loss is a good thing. However, why do I lose weight on a low-carbohydrate diet? Carbohydrates are it's the majority of the calories in an average person's diet. So if I take out all the fruit, and all the grains and all the bread and so forth is gone, and all the beans are gone, and all my pasta is gone, I take out all the carbs, I'm going to lose weight. Unless I eat so much fat and protein that my caloric intake stays the same, in which case you will not lose weight. So these diets do not defy the laws of thermodynamics. But the problem is that if I remove the carbohydrates, I may end up with a cholesterol problem. Now, I may not. This was a study, weight loss normally causes a reduction in cholesterol. And everyone's different, but typically a pound of weight loss will drop about roughly a point off your total cholesterol. However, if I achieve my weight loss with a low-carb diet, these numbers come from the Atkins Diet Revolution book. Saturated fat and cholesterol content very, very high. And if you contrast that with, say, a vegan diet where there's effectively no cholesterol, not much saturated fat, your prediction might be that the Atkins person is not going to do so hot. Well, at Duke University, in a 6-month study, 29 participants in the study had LDL reductions, which you should have, because you're losing weight, your cholesterol should fall. But 12 of the participants in this study had LDL increases. The average increase was 18 points, and one had an increase of about 100 points. So this was sort of a shot across the bow. So they did another study, also 6 months, and 30% of the participants had LDL increases above 10%. So in Philadelphia, around the same time, they did a 1-year study and showed that the average person's total cholesterol went up, their average person's LDL went up, and the conclusion that the researchers have come to is that a big concern about low-carbohydrate diets could be that it's not going to help your lipid levels very much and could make them worse. Okay, but your patient will say, but I need to lose weight. Will this help me lose weight? And the answer is it will, but Ken Hall and his group, many of you know Ken because he was here a couple of years ago at one of our earlier conferences, did a really interesting study. He brought 19 men into NIH and they lived there. And they had isocaloric diets that were either low carb or low fat. And he measured their body fat very carefully. And in a day's time, you could lose about 53 grams of fat on a low-carb diet and about 89 grams of fat on a low-fat diet. And at that point, Ken kind of closed the book and said, people can use low-carb diets if they want, and some people will do well because it may be better than what they were doing before. On the other hand, the advantage for going to a low-fat plant-based diet is fairly clear. Epidemiologically, the American Diabetes Association published these data in 2009, looking at BMI in Seventh-day Adventists. And the reason, of course, that they look at Adventists is you have a largely non-smoking, non-drinking, health-conscious population, including many vegetarians and vegans and so forth. And looking at BMI, as you know, BMI, healthy BMI should be below 25, we'll say. The meat eaters in this group were at 28.8. The semi-vegetarians were about 27.3 on average. And these are people eating meat less than once a week. Pesco vegetarians, pesco meaning fish, okay, a little bit skinnier. The lacto-ovo vegetarians, a little thinner, but I always have to tell my patients that a vegan is not a person from the planet Vegas. And as you'd expect, they're the thinnest group. And then when we look at diabetes prevalence, you see the same kind of difference, only somewhat more dramatic. And part of this is artifact because your vegans are more health conscious. They're typically better educated and they exercise more and so forth. But even when you adjust for those variables, the vegans have about half the risk of developing type 2 diabetes compared to the meat eaters. So let's shift gears and talk a little bit about diabetes. At Yale University, Jerry Schulman and Kit Peterson and their team have been doing some really, really interesting work on the causes of insulin resistance. And through MR spectroscopy, you can look inside the muscle cells and see what's going on there. And if, to simplify this a little bit, this is a muscle cell, and the reason I'm showing you a muscle cell is that glucose, that dreaded glucose, which is what your diabetic patient is worried about, my blood glucose is too high, glucose is trying to get into muscle cells. That's its main target. It'll also go to liver and it'll go to other cells, but most of it goes into muscle. And there it is outside the cell. But to get into the cell, it needs the help of a hormone called insulin, which is a little key that is going to go into that receptor. And the attachment to the receptor is normal in your diabetic patient, in virtually all of them. And then it signals these channels to open up and let the sugar inside. And that's what's not normal. That insulin signaling isn't working. And what's that about? And through MR spectroscopy, the finding is that the buildup of fat particles inside the cell is interfering with insulin resistance, interfering with insulin sensitivity. And of course, doctors hate words like fat because it's just one syllable, so we'll call it intramyocellular lipid. But it's the buildup of fat, largely from dietary sources, interfering with insulin sensitivity. So in our research study, we were funded by NIH to test a diet that in theory ought to change that. So we tested a vegan diet that was also low in fat versus a diet that I'm going to call following ADA guidelines, which at the time meant reducing caloric intake and keeping carbs fairly constant throughout the day. It was a 22-week study with a 1-year follow-up, and we've published a number of papers from this study, but just one quick finding. When you look at the patients who did not need any medication change in the course of the study, those people on the ADA diet had a good result. They dropped their A1C by 0.4 points, which is good. But the group on the plant-based diet, the vegan diet, dropped by about 1.2 just on average, which was terrific. I mean, that's the kind of thing that you want a really good medication to accomplish, and they did this just with a diet change. So this is a meta-analysis came out a couple of years ago of every study looking at plant-based diets and their effect on A1C, and now the zero line is in the middle there, and as you can see, the effects are pretty consistent, that you see improvements. And that's really, really important, because a plant-based diet has rice in it, and it has pasta, and it has beans, and you're encouraging your nervous patient to eat these foods, and they have been hearing for years that these things are going to affect them, and they will. They go home and they eat your spaghetti and their blood sugar rises for the first few days because they're very insulin resistant. And then after a while something happens, which is their blood sugar starts to fall and fall and fall and fall. And what we believe is happening is their intramyocellular lipid is starting to dissipate, their insulin resistance is starting to go away, their insulin sensitivity is returning, and you're reversing the course of this disease. How far will it go? It really depends on how soon you intervene in their life. You can't expect that a person whose pancreas has been pummeled by this disease for 25 years to throw their medications away and be diabetes-free. But on the other hand, it makes sense to have every patient begin this kind of regimen as soon as you can, and all the side effects are good ones. Their cholesterols fall, their blood pressures fall. We've seen many patients where their erectile dysfunction improves or goes away, and you're going to have happy patients. So there you go. This is a meta-analysis on the effect of plant-based diets on blood pressure. These are just the randomized clinical trials, systolic, diastolic, very consistent effect. Okay, so a plant-based diet has become a helpful recommendation, and there are many different ways of interpreting it, whether it's a Mediterranean pattern, an Asian pattern, a Native American pattern. We work a lot with the Navajo Nation right now and the Pueblo tribes as well, and everybody has their own way of interpreting it, which is fine. But your patient will turn to you and say, it's not just food, you know, you've been telling me about supplements. Do I really need supplements? And your patient will say, I think nature should supply everything I need. Which is true, it should. But you're not in nature. You're in a conference room in Washington, D.C. And so what that means is vitamin D normally comes from sunlight on your skin, causing vitamin D to form inside, but you're not there. And if you were in the sun at the beach, you use a sunscreen. That blocks the UV light. You're not getting any vitamin D. So this is where doctors say, I think 2,000 international units of vitamin D might be a good idea. Vitamin B12, very important. And your patient will say, do I really need that? And the answer is yes, you do. Let me talk a little bit about vitamin B12. This is vitamin B12. And it serves a couple of really important functions. You need it for healthy blood, and you need it for healthy nerves, healthy brain function. And it's not made by plants. B12 is not made by animals, it's made by bacteria. And you can get it in supplements. You can get it in fortified products. You can also, presumably, in theory, don't try this at home, find it in soil, which is where sometimes animals may pick it up, and it's also in meat, because the bacteria in a cow's gut make it. And yet, why would people get deficient? You need stomach acid to cleave B12 off of meat. If you are maybe over 50 and you're not making as much stomach acid, if you are on an acid blocker, if you are on metformin, your absorption is going to be diminished. And on a plant-based diet, you may be getting B12 from fortified products, but you could well have a lack of B12 in your diet. So deficiencies take years to develop. There are no early symptoms, but once a person has nerve disorders or anemia or psychiatric problems, you don't want to have to swim back upstream. So all your patients should be taking a supplement regardless of their diet. The U.S. government has recommended for a long time, anybody over 50 take B12. I recommend it for everybody. If your patient refuses, by all means test them and keep an eye on it, okay? And they will say, I think it's in fermented products, isn't it? And the answer is no. It is not in tempeh or spirulina or miso or any of those things. So a daily supplement is fine. It's in all the kids' vitamins and all the adult vitamins. You only need 2.4 micrograms a day. And if you take a 5,000 microgram dose, it will not hurt you. So there we go. All right, we good on B12? Now your patient says your favorite question, where do you get your protein? And let's take a minute and understand that too. There's a condition that we diagnose called protein anxiety. The patient has never had a protein deficiency, but is worried about getting enough protein, is not quite sure what protein is. So the protein requirements, the recommended daily allowance, if we're looking in pounds, it's about 0.4 grams of protein per pound of your body weight. If you're thinking metric, it's about 0.8 grams per kilogram. So for a woman, call it 46 grams a day. For a man, maybe 56. There's a margin for error. Most people would get by perfectly fine on less than that, but that's a good recommendation. So if you're not eating meat, or you're encouraging the patient to get away from it, are they going to get protein? Well, the amazing thing is a lot of foods have protein. Let's say I eat a 2,000 calorie diet, and all I ate tomorrow was broccoli. That was all I ate. I would get 146 grams of protein. If all I ate the next day was lentils, in 2,000 calories, I'm getting 157 grams of protein. If all I ate was corn or all I ate was oatmeal, I'd still get a lot of protein. Even if all I had was mashed potatoes and I threw the skin away, you still get a surprising amount of protein. Now, I'm not recommending that you do this, and I can hear you screaming, wait a minute, there's something about essential amino acids. Isn't that there's an issue there? And you remember this list from medical school, the essential amino acids? You are lying. You don't remember this list. And there's a reason you don't remember this list. It's you have never seen a case of threonine deficiency. You haven't seen it. Nobody came in really low on valine. And the reason is the essential amino acids are found in plant foods too. And normally we always look for a variety of these things. Your patients are not going to become protein deficient. It just doesn't happen. And the A&D came and weighed in on this and said vegetarian, including vegan diets, typically meet or exceed protein intakes as long as you're eating food, as long as you're eating enough calories. And that's also true for athletes. So athletes need more protein. They do. depending on what you're doing. So what do? They eat more food, and protein comes along with it. So the old notion that I grew up with in Fargo, North Dakota was your protein foods, meat has protein, but the vegetables, other things don't have protein at all. The thing to get across to your patients is other foods have protein. Vegetables have protein. Beans have protein. Grains have protein. If you took the meat off the plate, they're still going to get adequate protein, as long as they're getting adequate calories. So, what is this? What is this? This is air. So where do you get your oxygen? If you take a sample of air, it's about 21% oxygen, the rest is nitrogen. And now, can I get enough oxygen from breathing? What if I'm an athlete? If you're an athlete, you breathe more. So protein is a little bit like oxygen. There's some of it in the foods that you eat, and you're not going to become protein deficient unless you're eating nothing but candy all day. And then you've got lots of other problems, okay? All right, calcium, let's talk about calcium. Calcium is in green leafy vegetables. The cow does not make calcium. When you get calcium, there is abundant calcium in milk, that's true. But the cow doesn't make it, the cow eats it in green plants, grass. You can eat green plants too. Now spinach has it's got a lot of calcium, very poor absorption fraction. But most of the greens have a lot of calcium, and their fraction is good. They have less absolute amount of calcium, but a higher absorption fraction. So you'll get plenty of it. So greens are a good thing. And along with calcium, when you eat broccoli, you get beta carotene and vitamin C and iron and fiber, and you miss all the other things. So it's getting your calcium from green leafy vegetables it's a good idea. It has a lot of advantages that you're not going to get from dairy. Okay, your patient then turns to you and says, I went to the store and I got this veggie burger that had no cholesterol, but I saw something about on the internet about soy. And what your patient means is that there are compounds identified in 1931, if I'm remembering correctly. Genistein was isolated. It's an isoflavone. And it does have a structure similar to estradiol or testosterone, for that matter. And this leads to the concern that it could feminize men, reduce their fertility, and cause breast cancer in women. And if you go on the internet, that's what you'll see some people suggest. Studies clearly show no harmful effect on fertility. And if you have any question about that, go to a country where soy products are routinely consumed, like China or Japan, and you will be quite convinced that fertility has not been impaired. With regard to breast cancer, in 2008 there was a good meta-analysis of 8 studies looking specifically at Asians and Asian Americans, because you get quite a broad range of soy intake in this group. And the group with the highest soy intake had about a 29% reduction in breast cancer risk. A later meta-analysis, a few more studies, showed the same kind of result, that those people eating the most soy had the least risk of breast cancer. And what we're talking about here is soy milk, tofu, tempeh, miso, kind of everyday products. It probably doesn't matter if they are fermented or unfermented. And then for women who have been diagnosed with breast cancer, and their well-meaning oncologist says, don't eat any tofu, in 2012, there was a combined results of 3 studies done at that time showing that those women consuming the most soy had about a 30% reduction in the risk of cancer recurrence. These are women previously treated for cancer, and if they had the most soy, their cancer was less likely to come back. Then the following year, we now got 5 studies, and the same thing happens. And I broke it down into estrogen receptor negative and estrogen receptor positive. Either way, you seem to see the same benefit. So let me be clear. To encourage your patients to eat vegetables and fruits and beans and whole grains does not mean signing them up for the soybean cheerleading club. They don't have to eat soy products. They're totally optional. But there's no reason to assume that they would aggravate cancer risk. And they're handy. Soy products can replace milk or cheese or meat, and one day they'll make snow tires out of them probably. They don't cause cancer. If anything, they do the reverse. Did you hear what the AMA did last month? The AMA, which 20 years ago was not such a big fan of getting into nutrition, the AMA did a good thing. They weighed in on this issue that the patient waking up in the coronary care unit is served eggs and bacon and so forth, and this is sort of poo-pooed by their well-meaning staff. And the AMA came out with this saying, they call on U.S. hospitals to improve the health of patients, staff, and visitors by providing of healthful food, including plant-based meals and meals low in fat, sodium, and added sugars, and eliminating processed meats. That means hot dogs, bacon, sausage, ham, the deli slices, from not only from the cafeteria but from the patient menus, and providing and promoting healthful beverages. So we at the Physicians Committee suggested that instead of having a meat group in the pyramid, which was enforced back in 2009, that we recommend simple, basic staples for Americans, fruit and grains and legumes and vegetables. And in 2011, the U.S. government actually responded to our request with what they called My Plate, and I'm not taking any credit for this. It does look somewhat similar to what we sent, and there are two differences. We said legumes, and they said protein. The protein group says that it could be meat, but it could also be beans or tofu or nuts or any food that is protein-rich. And the dairy group was added. To their credit, they said it can be dairy milk, but it can be soy milk too, no problem. So vegan diets are fine. So for the first time in American history, there is no meat group anymore. It's gone. And my hope is that we will start to realize that we can get more and more toward simpler dietary products. Let me stop at that point. Thank you for your attention.